discuss about the axis in the ECG. In our previous class, we have discussed about the rate and rhythm. Okay, so today's topic will be the axis in the ECG. The topic will divide in total 6 parts. First will be the introduction, second will be the physiology of the axis, third will be the ECG leads which determines the axis, fourth will be the rule how to go clinically to determine the axis, fifth will be the clinical approach, how the axis helps in the clinic, and sixth will be the how we face in the exam and viva the axis part. Okay, so these are the total 6 part we are going to discuss. First, let's start with the introduction. Okay, so introduction and physiology of axis is important. Now, if you see the axis, we have to divide the axis part in two approaches. One, let's understand physiology. Second, let's understand what is the clinical implication of axis. Okay, so you have two parts. One is physiology and second is clinical. So first we are going to focus is the physiology of the axis. Now, if we see physiology, first thing is what is axis. Okay, so axis is a direction of the current which flows through the heart. Okay, now the current in the heart we have learned in our physiology flows through the specialized conduction system which starts with the pacemaker, which is SA node. Okay, so what is the location of the SA node? SA node is located in the, suppose this is your right atrium and this is your left atrium, this is your RV and this is your LV. The SA node is located superiorly in the right atrium somewhere here. Fine. So this is your SA node. The current starts from the pacemaker SA node, goes to the AV node, which is also located in the right atrium but inferiorly. Fine. So this is AV node. Fine. So current will go from SA node to AV node through the specialized conduction system. The flow of the current you have to focus is from here to here is in this direction. Okay. So axis, what we remember, it's a direction of the flow of the current. Fine. So this is up till now we are clear that up to from SA node to AV node this will be the flow. Now if you see the conduction system continuation from AV node you will have bundle of His. Okay, so this is the bundle of His. After that you will have left bundle branch and right bundle branch. Left bundle branch again is divided in the posterior branch and the anterior branch. Okay, so after this branches it will give Purkinje fibers. Fine, from here, even right bundle branch will give Purkinje fibers and will depolarize the ventricle. Okay, so this is the electrical conduction through the heart. What we need to focus is the direction of the flow because that's what we call axis in the ECG. Fine, so the direction here is this. Okay, so this is your axis of the heart, what we are going to determine by the ECG. Now what we understood by the axis, it will give you the direction how the heart is getting activated from the pacemaker to the ventricles. Okay, so it's a direction of the electrical activity of the heart we are going to decide through the axis. Fine, so this is the physiology what we understood and we have learned in the physiology of the first MBBS. Now when it comes to real-time ECG, how to determine this direction. Fine, so that we are going to learn through the ECG leads. So we have understood the physiology of the axis. Now next thing what we are going to discuss is ECG leads, how it helps to determine the axis. Fine, so ECG leads we have learned in the physiology. There will be the limb leads and there will be the chest leads. Okay, so we have limb leads and chest leads. Okay, to determine axis, these chest plates are not going to help, so let's forget it. Okay, so we are not going to discuss chest plates in this class. What we are going to discuss is the limb leads. Okay, now limb leads we can divide in two parts. One is bipolar lead and second is augmented leads. Okay, so we have limb leads, bipolar and augmented. Fine, so how this leads help in the axis will determine, but before that we should know how these leads are set on a body. Okay, so when we are doing the ECG we are going to use first limb leads. Okay, so limb leads are lead 1, lead 2 and lead 3. Fine, so these are the three bipolar leads we are going to learn. Okay, now lead 1, it's taken from the, it's a bipolar, so first we start from the right upper limb and goes to the left upper limb. Okay, so from right upper limb or right shoulder to the left shoulder. So if we are on the patient, one lead will be put here, that's the right upper limb, and second end of the limb, bipolar lead will be here, that's the left upper limb. So the direction will be this. Okay, so this is your lead 1, fine. If you see the lead 2, it will be start from the right upper limb or the right shoulder, it will go to the left lower limb, fine. So this is your lead 2. Okay, so if you see in the patient, it will start from right upper limb here, it will go in this direction to the left lower limb. Okay, now third what we are going to discuss is the lead 3. Okay, so lead 3 will start in the left upper limb and it will go to the left lower limb in the direction like this. Okay, so this is your lead 3. So you can see here lead 1, lead 2, lead 3, which are our bipolar lead. Let's put it on a graph. Okay, so if I put from here, this is my lead 1 going in the direction like this, and if I tell it's a 0 degree, and this is lead 1. Lead 2, if I start from here, from the right upper limb to left lower limb in this direction and at the around 8 degree or 60 degree angle, fine. So this is your lead 2. Okay, if we start lead 3 from the left upper limb to left lower limb like this, it will be your lead 3 at the angle 120. Okay, so we can see here lead 1 in the 0 degree, lead 2 in 60 degree, and lead 3 in 120 degree. Fine. So this is your bipolar leads. Now we'll understand the augmented leads. So augmented leads are again the 3. Towards left, that is AVL. Okay, so towards left, that is AVL. Towards right, that is AVR, and towards foot, that is AVF. Okay, so how these leads are kept in a patient? It's from the center of the body towards the left, this is AVL. From the center of the body towards the right, it's AVR, and from the center of the body towards the foot, that is AVF. Okay, so this is towards the right AVR, towards the left AVL, and towards the foot AVF. Fine. So these are the 3 leads to understand AVR, AVL, and AVF. Okay. So these are the augmented vector towards left, towards right, and towards foot. If I put this same graph to this diagram of the augmented leads, this is from the center of the body going towards the left. This is your lead AVL. Okay, it will be at the minus 30 degree angle. Fine. This is your lead AVL. If I put here from here, it will be lead AVR. Okay, so this is your lead AVR in the ECG. And if you put the AVF towards the foot at 90 degree exactly, if it is take from this line. Okay, so this will be your AVF. Fine. So right now we have understood bipolar leads and augmented leads, which are going to help us in determining the axis. Before we go for that, let's put both bipolar and augmented on single graph and understand how actually it looks. Fine. So before we start, this is your 0 degree, 90 degree, 180 and minus 180 or minus 90, sorry. So this is your minus 90. Okay, now let's draw again the limb leads, okay, or the bipolar leads. So this is lead 1, fine, at the 0 degree, fine. So lead 1 is here at the 0 degree. Let's draw lead 2 at the 60. Okay, it's at the 60 degree. Let's draw lead 3 from here. It's lead 3 at 120 degree. Okay, so lead 1 at 0 degree, lead 2 at 60 degree, lead 3 at 120. Okay, now let's put the augmented lead on this graph. Okay, so first was AVL towards the left, and this angle will come to minus 30. So AVL minus 30 degree. Fine. If we draw the AVF here, okay, its exit at the 90 degree. So AVF will be at the 90 degree. If we draw this AVR here, we can take at the 210 degree. It won't matter much. Let's see, these are the augmented leads in the black: AVL, AVR, AVF, and in the red we have the limb leads 1, 2 and 3. Okay, so we know these leads, how they are set and how they are kept on a patient. Now we are going to utilize these leads to decide the axis. Okay, to decide the axis you have to remember one rule. Okay, what this rule says. Okay, so this is the one thing in the ECG, when you will learn you will remember forever. Okay, so ECG is actually a physics, correct? It records the electrical activity of the heart. Okay, and you are recording the electrical activity in the leads by putting the leads at the various sides of the body. Okay, so a lead will record a positive deflection if current is flowing towards that lead, and if current is flowing opposite to that lead, it will record the negative deflection. One more time, a lead will record positive deflection if current is flowing towards it, and negative deflection if current is opposite to that lead. Fine. So this rule you have to always remember, and you have to determine your axis. Fine. So now for the previous physiology, let's do one more time. SA node, AV node, bundle of his, left bundle branch, right bundle branch, left bundle has posterior, anterior. So ultimate flow direction is this. Fine. Now this direction, what we are getting from SA to the ventricle, can you correlate here, somewhere here? Fine. So the flow goes from the SA node somewhere here in the right atrium, then AV node, then bundle of his, then you get the left bundle, right bundle, left bundle as the posterior branch, anterior branch, and the ventricle gets depolarized. Okay, so this is your flow what you are going to get. Fine. So now we can see the ECG axis is almost towards the lead to maximum, or we can tell it's between the 0 degree and 90 degree. Okay, if you see the ECG books, most of the books and the real physiology says the normal ECG axis is between minus 30 to plus 90. Okay, so minus 30 to plus 90 is the normal axis. Okay, but sometimes clinically we keep 0 degree to minus 30 degree as the left side, so borderline left axis deviation, and from minus 30 to minus 90 as a left axis deviation. Fine. So till now we have understood that what ECG axis will show is the flow of the current towards this, and rule we remember, a lead will record a positive deflection if current is towards it, and negative deflection if current is opposite to that lead. Fine. Suppose now we are going to use this lead 1 and lead AVF for determining the axis. Okay, so how this magic is going to work, let's understand on the board first, then we'll go on the real ECGs. Fine. Suppose I have a patient whose ECG lead 1, the QRS complex you have to focus for positivity and negativity. Okay, so lead 1 QRS complex is positive, means if you see the Q wave, then R wave and the S. Fine, it's a positive QRS complex. So with rule if you apply, lead 1 is recording positive complex, means your current is going to flow towards this direction. That is first thing decided. Okay, because it is recording a positive current. Okay, now if you see the lead AVF, the same patient, lead AVF also has positive QRS. Fine. So this is the positive QRS. It tells current is flowing towards the down AVF. Now see, current can't flow in the two direction, but if both leads are positive, it tells current is between these two. Fine. So between these two, 0 to 90, we know that is the normal axis. So now you apply clinically. If in your given ECG, lead 1 and lead AVF both have positive QRS, you are dealing with a normal axis between 0 to 90 degree. Fine. So this is understood. Now let's go for another example. What we are going to use is lead 1 and lead AVF QRS complexes. Fine. So first we understood 1 and AVF, if both QRS are positive, that is normal axis. Now I got a second patient. In that lead 1 was positive QRS. Okay, so lead 1 I got the positive QRS and we know Q, R and S. Fine, this is positive QRS. But lead AVF had a negative QRS. Okay, so lead AVF had the negative QRS like this. Fine, let's see how the rule is going to help us. Lead 1 is showing positive, so it tells the current is flowing towards this direction. Fine, so this is lead 1 of the given patient and the current is flowing towards this. Fine, but lead AVF is negative, so the positive AVF is this, the negative AVF is opposite to this. So lead 1 is positive, AVF is negative, it will tell the current is between these two. Fine, so the direction of current is towards the left, that is the left axis deviation. Fine, so if your lead 1 is positive and AVF is negative, what you get is the left axis deviation. Okay, fine. Now to tell is it completely abnormal, it's little doubtful, because what we learned 0 to minus 30 can be a normal axis still. Fine, but for clinical purpose we'll just remember right now, if lead 1 is positive, lead AVF is negative, it's a left axis deviation. Fine. So now next one more example we'll take. We got a patient whose lead 1 is negative and lead AVF is positive. Let's understand with the rule. Lead 1 is negative. This was the normal lead 1 direction here, but here it's a negative. So the current is flowing towards this. Fine. So the current is flowing towards this. This is lead 1 negative. What is lead AVF? AVF is positive. So it will flow towards this. So your ultimate current is between these two. This is rightwards, that is right axis deviation. So in a given ECG, if lead 1 is negative and lead AVF is positive QRS, what you are going to get is right axis deviation. Fine. So once you remember the rule, the lead records positive deflection if current is towards it, and negative deflection if current is opposite to it. It's very easy to determine the axis. Now let's take the last example on the board, how to approach with one more ECG. Okay, so I got one more ECG where what we got is lead 1 negative and lead AVF negative. Okay, so here if you see the rule, lead 1 is negative, so the current is flowing towards this. Fine. Lead AVF is negative, the current is flowing towards this, that is here. So the current is between this two, lead 1 and lead AVF. Fine. So what we find here is the current is flowing towards that, and what we learn physiology, SA node, AV node and the ventricle. So either the heart position is totally changed or the electrical flow is coming from the ventricle and going towards the atria. Okay, that happens in ventricular tachycardia. Right now we won't go in the detail, but we can have the axis which is towards the northwest or the extreme axis deviation when 1 and AVF both are negative. That's called extreme axis deviation, or some people tell it northwest axis deviation. Fine. So with this rule you can learn a lot about the ECG axis to determine. Let's revise one more time. Lead 1 positive, AVF positive, normal axis. Lead 1 positive, AVF negative, left axis deviation. Lead 1 negative, AVF positive, right axis deviation. 1 AVF both are negative, you get the extreme axis deviation or the northwest axis deviation. Fine. So these are the things how to determine the axis clinically. Now in the next session we are going to practice on the real-time ECG, how these axes are determined when the ECGs or the real-time ECGs are given in the clinics or in the exam. Fine. So let's end here and we'll discuss the exam and viva as well as the clinical approach.